Yes, to our media advisory this January the 10th, 2022. I'd like to welcome our short cast today, Jason Thorne, our Emergency Operations Center Director, and Dr. Elizabeth Richardson, our Medical Officer of Health. And as you know, the highly transmissible Omicron variant has resulted in essential public health measures to reduce the spread and protect our progress in the fight against COVID-19 and protect those who are most vulnerable in our communities. And we as a city are focused on making sure that the essential and critical city services residents rely on continue to be delivered. So we must continue to stay focused and do all of the work that we feel necessary to blunt the rising case counts and to impact our healthcare system. The increasing strain on our local healthcare system must be addressed and decisive action taken. So these public health guidelines and efforts are layered and will require a collective community response in order to see changes. So please do continue to wear your mask and wash your hands. Keep your distance from other people. Limit indoor social gatherings to a maximum of 5 people while maintaining at least 2 meters from others you do not live with. And if you have COVID-19 symptoms or are not feeling well, stay home, self-isolate. It doesn't require a test to do that. If you have flu-like symptoms or sniffles, the best thing you can do is stay home and not spread it to anyone else. And most importantly, get the vaccine or your booster shot. And all of the facilities to be able to do that are readily available to you, and in fact, even more available than they have been in recent weeks and days. So we know that the vaccination continues to be the critical piece to fight against COVID. The physicians and nurses and pharmacists and clinical staff alike are bringing the best of our community to light and stepping up in these efforts to expand the Hamilton COVID-19 vaccination campaign in a concerted effort to sustain an extremely strained healthcare system to benefit all of us. So we remain committed to getting as many COVID-19 vaccines into arms as possible. And we've mobilized additional human resources to support vaccine clinics in our city. I think as we've previously identified, we've closed our rec centers and our museums and are at 50% capacity in our libraries. All of that staff has been put into the vaccination effort in all of our facilities across the city. And everything we're doing is to protect the residents and protect our healthcare system to ensure it is available for all of us. So it's instrumental for everyone to stay vigilant and continue to follow the public health guidelines and restrictions as set out by the province of Ontario and supported by our Medical Officer of Health. So I'm now going to pass it over to Jason Thorne, our EOC Director, our Emergency Operations Center Director, for some updates from the city's perspective. Jason?
Thank you very much, Mr. Mayor. As the mayor noted, we remain in step 2 of the province's roadmap to reopen, which began last week on Wednesday, January 5th. And that step does include a number of enhanced measures as well as enhanced restrictions that are in place to help slow the spread of the Omicron variant. A full list of these measures can be found on the city's website, and the province has indicated that they will be in effect for at least 21 days, which takes us to January the 26th. That move to step 2 does affect some of our city services. In recreation, the programs for the winter season, which were scheduled to begin this week, have been canceled, and credits and refunds are available to many members of the public who had signed up. Those will be processed automatically, although if any members of the public wish to contact recreation staff, they can do so through the city website or email to get an update on status of any refunds. Our outdoor rinks are open. And they continue to be available on a first-come, first-served basis. There are capacity limits in place of 50% of their normal capacity. I have some updates as well with respect to some city services that have been affected by our current staffing levels. We continue to work very closely with Hamilton Public Health Services and our healthcare partners from across the community to scale up our COVID-19 capacity across the city. Currently, 245 city staff have been redeployed to directly support the frontline vaccination clinics. We are therefore planning for some staff shortages, both due to those redeployments as well as due to the impacts of staff isolation or quarantine periods that do have some impact on our operations. As of today, 176 city employees have either tested positive for COVID-19 or are in isolation. 35 paramedic staff have tested positive for COVID-19 or in isolation. With respect to paramedics, these absentee rates due to illness are slightly higher than normal for this time of year, but not significantly so. And so staffing levels and services are being maintained. In transit, HSR has announced a modified schedule that will be effective as of January 23rd and will run up until April 30th. For the most part, this is looking at modified services schedules to existing routes. Saturday and Sunday service levels are remaining unchanged, but a select number of routes will be operating at a reduced level of service. On our core routes, we will be maintaining our regular service levels. Full details of these service changes are available on the city's website, and customers are also encouraged to download the HSR app on their devices to get the most recent and up-to-date information. And finally, in long-term care, as of today, approximately 17% of staff between Macassa and Wentworth Lodges are either off sick or are isolating, but overall staffing levels are stable. That's thanks to the support of our casual team members, as well as staff working overtime, and also the support from some of our redeployed staff. The senior management has been developing contingency plans if those staffing levels reduce further, but for now, staffing levels are being maintained. With that, I will hand things over to Dr. Richardson.
Thanks, Kevin. Thanks, Kevin. Thanks, Jason. I'm just checking my mute. Just wanted to make sure it's not still on. So good afternoon, everybody. Just wanted to update you around the cases and other things that are happening. As you know, the situation with regard to COVID-19 continues to be very concerning, as well as given where we're at in the global pandemic and the sharp rise in cases and the difficulty to continue to test, it's brought a degree of uncertainty in terms of where we're at. And as this continues forward with us leading this particular wave, there's more uncertainty at this stage than perhaps we've experienced in other waves. So our 7-day moving average is sitting at 568, and the weekly incidence per 100,000 is 663. Do want to highlight again that those numbers are quite underestimated with the rapid spread that we have in limited testing. We do know that the cases that are reported on the dashboard are just a portion of the active cases that are going on in the community. And so we're continuing to focus predominantly on key health indicators, including the number of outbreaks in highest risk settings and their severity, as well as hospitalizations, ICU admissions, and deaths. To that end, today, the average number of daily new hospitalizations and ICU admissions have been on the rise and are sitting now at approximately 10 new hospital admissions per day on average, and more than 2 new ICU admissions each day. This is already higher than we have seen in previous waves of the pandemic. The average number of deaths occurring per day remains low, and that is in part something that we'll continue to monitor over the coming days because it is a lagging indicator, as we've talked about before. There is 1 reported new fatality since Friday, January the 7th. On an outbreak front, you'll know that we're focusing and reporting only on outbreaks that happen in high-risk settings like long-term care homes, retirement homes, other congregate settings, and hospitals. We're currently sitting at 74 active outbreaks in these settings, with 12 new outbreaks being reported and 3 outbreaks being declared over since Friday, January 7th. As you know, effective December the 23rd of this past year, we're focused on only these settings, and all of the details about these can be found on our dashboard. The number of Omicron cases is rising so rapidly in Ontario that anybody who does have symptoms consistent with COVID-19, as the Mayor said earlier, can be presumed to be infected with the virus. There's no need to get tested. Rather, those who have those symptoms should stay home and self-isolate immediately. They should inform those who they've been in close contact over the past 48 hours, and their household contacts should quarantine while other contacts monitor for symptoms. The exception to that would be any contact, whether that's out in the community, that they should stay away from any sort of long-term care home, retirement home, or other high-risk setting. All the information about that can be found on our webpage at hamilton.ca/COVID. COVID testing itself continues to be prioritized to help protect those that are at greatest risk of severe illness and death, as well as those living and working in high-risk settings. This, of course, is part of the mitigation that's being put in place to impact our hospitals, or to mitigate the impact on our hospitals and our broader health system and on our community overall. It does appear that the Omicron variant does appear to be less severe in terms of its symptoms, and most people do not need medical care. And so self-care at home is a very important part of what people need to do to get rest and to heal, as Dr. Packer would say. At the same time, if you are experiencing symptoms and have questions, calling through to your primary care provider is an important service that you have available to you, and working with them and determining if you need any sort of closer monitoring as you go. As always, if you are have more significant illness, have more significant symptoms, then you should go ahead and seek care, seek medical help in person as well. Along with that management of COVID-19 at home, there are a number of measures in place as part of modified step 2 to help blunt the Omicron wave. And between these measures, along with the other vital tools like vaccination with our first and second doses of vaccine, and as well a third dose now, of course, the booster dose, the public health measures are very important as well to assist with stopping spread. So wearing a tight-fitting mask properly, maintaining physical distance, limiting contacts and the size of social gatherings, as well, of course, most importantly, staying home if you're unwell. So this is very important as we go forward, knowing about how important vaccination is. The partners here in Hamilton have been working very hard around the clock to plan and evolve our vaccination strategy. We've now administered over 1,100,000 COVID-19 vaccines locally. We have an estimated 85.3% of those 5 years of age and older in Hamilton having received a vaccine to date, and over 80% now are fully vaccinated. There have been over 208,000 third doses now administered in Hamilton. 45% of those eligible to get a third dose have received it as of January the 6th, and 41.2% of children 5 to 11 years of age have received a first dose. So in order to make vaccines as accessible as they can, the teams are now beginning today at the Centre on Barton Vaccine Clinic and the Mountain Vaccine Clinic at Lime Ridge Mall. Those two mass vaccination fixed sites are where children 5 to 11 years of age can now walk in to receive their first or second dose of a COVID-19 vaccine. This is in addition to offering walk-ins of a third dose at the Centre on Barton for those 50 years of age and older that was announced last week. This additional access for kids that are 5 to 11 will play a role in adding an additional layer of protection to our school environments as they prepare to return to in-person learning. Increasing our vaccination rates amongst students and staff is going to be key to help balancing the risks within local school and childcare settings. To that end, we were encouraged that the province added Hamilton to its list of sites last week, where there is an additional clinic that's being offered for education and childcare workers to receive their third doses. So that clinic is available through FH Health. They have a clinic at 1241 Barton Street East near the GameStop at the Centre on Barton. Because this is a provincial initiative, they have their own booking system, so they can't be booked through Hamilton's booking tool. We do operate as well the public clinic there, and we have that over by the Brick and Giant Tiger. And it's important as people come into those two locations to double check which of the two sites it is that they're booked into for their third dose if they're heading over to Centre Mall in the lower city. So of course, we really encourage people to get their doses as soon as they can, whether those are first, second, or third doses. Very pleased to say that as of early this morning, we had about 30,000 appointments available over the next 14 days. We have had certainly days where we have same day or next day bookings, and that continues to be the case as we move forward, as we're seeing. We've also made changes to the booking tool to make it easier for people to see appointments and to navigate the tool more seamlessly. We'll continue to work as well with our school boards and the childcare providers to promote the availability, whether through the provincial clinic or through our own clinics, and encourage appointment bookings into the community, into these clinics within our community. With the scale up of this, we are anticipating that we will meet all demand for third doses by the end of this month. Anyone who wants a third dose should be able to get one by the 31st of January. At the same time, we now know fourth doses are important to protect the health of our seniors in congregate settings like long-term care homes and retirement homes. And so we will be starting to administer those vaccinations alongside the staff in those long-term care homes in the coming weeks in order to protect those that are most vulnerable. So as always, you can find everything about the vaccine on hamilton.ca/getyourvaccine, except for, of course, that new walk-in option or that new option at the Barton Clinic that the province is providing. And of course, our pharmacies have been doing a bang-up job as well in getting vaccines out into the community. And so you can check in with your local pharmacist or pharmacy group to look at where you can get vaccines through that route as well. With that, Mr. Mayor, I'll turn it back to you.
Thank you. And thank you, Dr. Elizabeth, and thank you, Jason, for all that information. And our efforts continue to be to ensure neighborhoods across the city have access to the vaccine, and that effort will continue. And for not only the first and second doses, but for the boosters as well. And that still is the best way to protect yourself and your loved ones. So just to reinforce that once again, get your vaccine as soon as you can. And lastly, I'd like to remind everyone the importance of wearing that mask or face covering in indoor public spaces. I see, anecdotally that, the vast majority of the population is doing that, and that certainly continues to be an important line of defense as we move through this next wave of COVID. So on that, nothing more to add from me. Jasmine, I'm going to turn it over to you, and certainly we'll be ready to field any media questions. Jasmine.
Great. Thank you very much, Mr. Mayor. We have 6 media joining us today. As usual, we will start with one question and one follow-up for everyone. Our first question will be to Nicole Martin from CHCH. Nicole, you can go ahead.
Thank you so much, and happy Monday to everyone. My questions today are for Dr. Richardson. Dr. Richardson, I spoke with the critical care lead at Juravinski Hospital today, Dr. Bram Roshberg, and he refers to Hamilton as the epicenter for critical illness related to COVID and also COVID in general. Why has Hamilton become this epicenter for COVID-19 critical care patients?
Thanks very much, Nicole. I think, what we saw just before Christmas was we saw rates increasing quickly here in Hamilton. And so we know that hospitalizations and ICU admissions do lag behind by a couple of weeks, a little longer for ICU admissions after we see that uptick. And so while Kingston, Frontenac, Lennox, and Addington, the Kingston area was the first in Ontario to see that upswing, certainly other parts of Ontario, including ourselves, have been sort of the next line that have seen those upticks that have been happening. As well, of course, we know that our colleagues in the healthcare system here in Hamilton are a great resource for all of the Hamilton, Norfolk, Haldeman, Norfolk, Hamilton, Niagara, Brant, HNHB, Lynn area. And so they are providing those resources as well for a lot of people that are around us and have been helping out other parts of the province at times as well. So definitely an area where a lot of expertise is recognized, a lot of care does happen. And with this particular wave, we do appear to be more at the leading edge of this wave.
Nicole, if you'd like a follow-up, you can go ahead.
Okay, my follow-up is also, what more can you, Dr. Richardson, do as Hamilton's medical officer of health to encourage the province to get more nurses into hospitals? We're hearing at Juravinski that within their ICU right now, they have some nurses caring for up to 4 patients when it should be one-on-one care. So what types of calls are you making to Minister Elliott or Dr. Moore to see what we can do to get more nurses into the hospital systems here?
Thanks, Nicole. So, the whole issue of health human resources has been a significant one for a long time now during this pandemic. And so we have seen not only the impacts of the disease itself in terms of people right now becoming ill or being office contacts, but of course the burnout of the very long-term long time that this has been going on, this particular pandemic. And so whether it's in the hospitals or in any aspect of the health system today, there are calls for many different things in terms of how to support people as they go forward. So we know there's been concentrated effort on bringing retirees, for example, back into the workforce, a lot of discussion about how to support healthcare worker well-being as we've gone through these initiatives and help support them to stay in their positions. So many, many different aspects have been discussed, but nonetheless, it doesn't make up for the fact that both, numbers are tight all across this province in terms of number of nurses that are available, as well as the impacts that the disease and the control measures are also happening. So it's a big discussion in every part of the healthcare system as to how we can continue to support those workers. And part of that is, of course, the public health measures that have been put in place to blunt this wave so that we can continue to support those workers in the work they do and make sure that there's care for all of us, whether it's to help us with an episode of COVID-19 or whether we're there for another reason, like a heart attack or some sort of major accident.
Thank you, Dr. Richardson. We'll go next to Diana Weeks from CHML. Diana, you can go ahead.
Hey everyone, happy Monday. Hope everyone's doing well. Just a quick question, and apologies if it was addressed. I ended up tuning in a little bit later, so if it has been, please just let me know. It's just with regards to the new restrictions that went into effect from the province last week and how it's being enforced at local businesses, particularly hospitality sector here in Hamilton, so restaurants, that kind of thing. I know there's been some talk about some restaurants in Hamilton that have not been following some of those guidelines since they went into place, and I'm just asking if we know what's being done about that.
Yes, thanks for the question, and I can respond to that. So enforcement has been continuing. As we've done in previous situations where rules changed or new provincial rules were put in place, we will usually lead with a couple of days where we focus more on education and sharing of information before we proceed to enforcement with respect to any of the new restrictions. So we did do some outreach and education in the early days of the new rules being in place last week. But we have been also continuing with enforcement of some of the existing regulations, notably around the masking. That continues to be one of the areas where we continue to see issues and laying of charges. We did lay 14 charges over the past weekend against 5 different businesses. For the most part, those were related to face covering violations. We did lay charges against 2 businesses, 2 restaurants that were operating indoor dining in contravention of the provincial regulations.
Okay, thank you so much. That answers my question.
Would you like a follow-up question, Diana?
I'm okay, thanks.
Okay, great. Thank you. We'll go next to Don Mitchell from CHML. Don, you can go ahead.
Yeah, thanks very much for taking my questions today. I'd like to work on the segment of shelters in the city. So as things stand right now, as far as I can see, there's 6 outbreaks, roughly 60 cases or so. And so when we think about things that are happening in that system right now, we've got the cold weather, we've got the encampments closing up, the Omicron variant circulating. The CEO of Good Shepherd this morning told us that they're full up. And I want to know, I wanted to see if, and I believe this is a question for Jason Thorne, to kind of give me an idea of how capacity is going in the system right now. Do you have any numbers that you can potentially tell me increases since the last time this was addressed at council, which I think was March 31st of this past year? Because it seems like things are a little stressed there.
Yes, I could begin, and then I'll see if Dr. Richardson wants to add anything. And yes, we are looking at some at capacity issues in some of our shelters. For the most part, they are near or at capacity. Our housing services group is working with our shelter network and our partners who operate the shelters to identify ways to try to improve some of the capacity that's available. With respect to outbreaks, I'll let Dr. Richardson weigh in. We have been looking at ways of providing for isolation in situ in some of the shelters to address that, but probably better for me to let Dr. Richardson respond.
Well, thanks, Jason, and thanks, Don. Certainly we've been very, very aware of the challenges in our shelters all the way through this pandemic, and making sure that we balance the risks, particularly in times like this when we have very cold weather outside, and the risk of COVID-19 as well. So working with all of the shelters to look at how to best continue to operate and shelter in place as much as possible, with cohorting and those sorts of things put in place. So I don't know that I have much to add over what Jason's said.
Oh, and my follow-up question would be in terms of, vaccinations there. Obviously, that's a concern with the congregate setting. So can you tell me what the city will be doing in terms of vaccinations, any type of rollout that would be going out for shelters specifically?
Thanks, Don. Yeah, we're very fortunate to have the Shelter Health Network working with that population, and they have been throughout this pandemic providing support to the shelters and to the homeless population in terms of vaccination. So they've been working on that throughout, including this rollout for the third doses and booster doses.
Great, thank you, Dr. Richardson. We'll go next to Tevia Morrow from the Hamilton Spectator. Tevia, you can go ahead.
Sorry, thanks very much. Just had to unmute myself. I think I'm going to follow up on Dawn's line of questioning. Last week, some shelter operators told me that if they had to provide isolation space in situ, it would be very challenging for them. And part of the challenge is they simply are completely stretched already with staffing. And they told me that basically they're really concerned about being able to accommodate that. Why can the city consider, I mean, we had Beneto Community Center that was open last year, for example. Is that a consideration this time around?
So I'm not sure if Dr. Richards trying to speak there, but I'll begin and then I'll let her weigh in. We did have the isolation shelter in place last year, and we've been looking at whether or not there is additional capacity that we can provide. The staffing shortages, though, do create a pressure in terms of bringing on any new facility in terms of shelter capacity. So at the moment, what we're looking at is to maximize the capacity we have available within our existing staffed shelters, but do recognize that they are currently, as I said earlier, either at or near capacity. But we are continuing to work with those shelter providers to see where we can provide additional space. And Dr. Richardson, I don't know if you would like to add anything.
Yeah, just to say, Don, or Tevia, very much in keeping with what you're saying and the challenges that are there. Our staff in the outbreak team do work through with each of the shelters as they experience any sort of disease that happens in those shelters, any outbreaks, work through them to look at how they can best isolate where they are. Some of them are still able to move people to the isolation facility, but in other cases, they've been able to work out a situation where they can isolate them appropriately on site.
Jasmine, as a follow-up, if I may. So the other piece of this, and I'm sure this is not lost on either of you, is that there are people who simply can't get into shelters because there are no beds, or our shelters have halted intakes. What are they supposed to do to self-isolate if, I mean, they have no, I mean, the advice here is stay at home if you're feeling bad. And I think, before Christmas, council, back to sort of a suite of measures to expand the shelter system, at least temporarily. Where are we with that? Why is this situation unfolding? Could this have been predicted?
So again, I'll start, and Dr. Richards can add if she wishes. I think where the issue that we're facing right now largely is around the staffing shortages and the staffing availability. So we do have some of the temporary facilities that have been brought on stream, and council did approve funding for those throughout last year, including in the fall. But the staffing shortages do create a challenge in terms of bringing on additional capacity within those facilities.
Great, thank you. We'll go next to Joanna from Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the questions. My first question is for Dr. Richardson. Hamilton has about 41% of 5 to 11-year-olds with one dose. The province is at almost 47%. Why is Hamilton lagging when it comes to this group? Like, is there higher hesitancy here? Is it socioeconomic factors? Is it the rollout? Like, it's very concerning. Can you talk about what the issue is with this group?
Yeah, thanks, Joanna. It's one that we look at it with concern as well when we know that the rates have slowed. They slowed right after the first couple of weeks when we opened up to vaccinations in that group. We're very pleased we're up at the 40% mark. We often see that we get to the 40% mark and then things slow down, but it slowed down earlier than that for this particular group. And what we know about every age group that we've been through is it's multifactorial in terms of why people may not choose to come forward to get the vaccine, and in some cases lack access to vaccine, and having it, presented in ways that are culturally appropriate for them and all of those sorts of things. So, when we look at a vaccine rate this low, though, it is a more broader hesitancy piece that we are seeing in terms of people deciding to come forward. So very much, working with all of our health system partners, all of the community partners to make sure there's information available to people to talk through issues. We know Sick Kids, for example, has a vaccine clinic hotline that they can call and get further information about the shot, and all sorts of resources are available to help get information to people so they can think that through and make decisions as they move forward. From the standpoint of access, we've had booked clinics now for some time in order to make sure that kids have the time and the kind of situation where they can move through a vaccine clinic comfortably and have their needs met. And now we've been able to open that up to walk-ins as well, so that it's as comfortable as possible and as accessible as possible. And we have clinics not only at our fixed sites for pediatric doses, but throughout the community that rotate through as well. The next step will be for us, once we get through those fourth doses for our highest risk settings, we'll be looking at school clinics. We have seen for that age group that can help to bring up immunization rates. But I think it's going to continue to be a time and that commitment in terms of building relationships and building trust, as well as experience with the vaccine over time. This is an age group that hasn't seen a severe illness, and so people feel that I think that they do have the time to think about those decisions and take a little longer to make them.
Thanks so much for the answer. And my next question is also for you, Dr. Richardson. Today you shared with Board of Health the forecasting, the latest SCARS and forecasting. Has that forecasting been shared with Hamilton's hospitals, considering it focused quite heavily on the hospitals? And have they communicated to you their ability to take on the significant number of cases predicted by that forecasting? Like, what would those level of cases mean for the healthcare system here in Hamilton?
Yeah, thanks, Joanna. So that team that does the forecasting and supports it actually includes hospitals, primary care, public health. It's a whole group from the Greater Hamilton Health Network and the Hamilton COVID response table that do work with the forecaster, with SCARS, and together to look at what the forecasts are. Hospitals have been a key part in giving in the data needed in order to do the forecasting as well. So they are quite aware of those forecasts when they're brought forward. They work together on them. And, they have been very concerned about what this wave holds for them and their ability to meet it with all of the challenges that we talked about earlier in this press briefing when it comes to staffing. And that's why they are, very closely monitoring in terms of ramping down surgeries and looking at their abilities. They're working together with hospitals across HNHB and with hospitals across Ontario and Ontario Health West around things like load leveling to make sure that they have the capacity to care for any additional patients that come in. So it's very much a concerted effort across the whole hospital system. It's also why it's very important, the work that's gone on with primary care and the COVID at home care pathway, where people can be monitored virtually and cared for in that way, and supported in their homes through self-care or through added monitoring, so that it maintains as much hospital capacity as they possibly can have.
Great. Thank you, Dr. Richardson. We'll go next to Bobby from CBC Hamilton. Bobby, you can go ahead.
Thank you. I hope everyone had a nice, calm weekend, or maybe something fun, whatever you're into. Hopefully it was a good one. My questions are for Dr. Richardson. The Barton Jail has, 44 cases. What are you doing to manage that outbreak? And may you also please elaborate on how you manage an outbreak in a setting where physical distancing may be a challenge?
Thanks very much, Bobby. Yes, the outbreak at the Hamilton Detention Center, of course, is managed with the Solicitor General in terms of the corrections branch managing those outbreaks along with us. They are very challenging situations and not easy for the staff that are there, nor the people who are residing there at any given point in time. In terms of working through the infection control issues and ensuring things like physical distancing are maintained. So it is worked through in very much the same way we would do with any setting in terms of looking at infection prevention and control measures and encouraging that they're met to the greatest extent possible while continuing to maintain a safe environment for those in the center, as well as those that are working there. So vaccine, of course, plays a key role for that. And the Ministry of the Solicitor General has also been, rolling out vaccines for their staff and looking at vaccination opportunities for those that are there. So very much a similar process, but a very challenging environment in which to do that.
Thank you. And I realize in your role, you've been concerned about the safety of everyone in Hamilton, but I'd like to ask about you personally. In Niagara, we've seen the interim medical officer of health face protests and vandalism, threats, and the Niagara health director recently faced some similar stuff. Have you been the target of protests at your home or vandalism, threats? Are you fearing for your own safety? Are you afraid?
Yeah, thanks very much, Bobby. Unfortunately, for many of my colleagues across the province, they have experienced those sorts of direct threats. They have also experienced protesters at their home, very challenging, especially for those with young children. And it's been quite unsettling across the board. We're all very aware of those issues. The OPP, along with Hamilton Police, work with us when anything comes up. And I've certainly had my share of very unpleasant, nasty communication directed in or sent in my direction. And so we do work with, as I said, our security, our police, all of our colleagues to manage those situations. We've seen that as well directed towards our clinics at times, our vaccine clinics. And so again, we work with the appropriate authorities to make sure that they're kept secure. We hire private security in those situations and work with the police to ensure they're there. The province has been very clear that they want to support us in any of those sorts of efforts. And we've been working at that as we go along.
Thank you.
Thank you, Dr. Richardson. We have a bit more time, so we'll go through for one more question each. Go back first to Nicole Martin from CHCH. Nicole, if you'd like another question, you can go ahead.
Yes, thank you so much. Dr. Richardson, just going back to how Hamilton kind of became the epicenter of COVID cases and also now ICU cases. You mentioned it was before the Christmas break we really started seeing the spike. Is this due in part to lower vaccination rates to other regions across the province, or were you seeing spikes within Grey Cup parties or festivities? What really sparked this in December for us, or maybe November?
Yeah, thanks very much, Nicole. I don't, when we've looked at where this might have come from, we didn't see anything in particular that was specific to the Grey Cup itself. We certainly saw social gatherings, whether they were Grey Cup related or not, had been a piece of what was contributing to transmission beforehand, before the Christmas break, and then did see case numbers start to rise, particularly over that holiday break. So it's hard to pinpoint it to any one thing that might have been doing it. In terms of vaccination numbers, really, when you look at vaccine coverage across Ontario, by and large, it's pretty similar. We sit sort of in the middle third in terms of vaccination coverage for Ontario now, as they've updated their numbers and their denominators into certain numbers. So we're all pretty similar when it comes to that. So it's hard to point to anything such as that being the contributor to why one area may come ahead of the other. What we did see through that late November, early December was though that those vulnerable populations, in particular unvaccinated groups or other pockets, the virus would get in and work its way through those groups as it was moving forward and moving through our community. So I don't know that we're really that much different than other communities in Ontario, but Ontario as a whole was of course experiencing that uptick sooner than other parts of Canada.
Great. Thank you, Dr. Richardson. I'll go back to Diana Weeks. Diana, if you'd like another question, you can go ahead. Might have lost Diana. Okay, we will go next to Don Mitchell. Don, if you'd like another question, you can go ahead.
No, I'm good for now. Thank you.
Great, thank you. Go back to Tevye. Tevye, if you'd like another question, you can go ahead.
Yes, please. I was wondering if you could please tell us the circumstances of the two restaurants that were charged with indoor dining violations. What were the specifics about that? Was it table service, or did they get takeout, or were the customers eating inside? Jason?
Yeah, so takeout is permitted. So in the two instances where charges were laid, it was because sit-down indoor dining was being permitted.
I see. Okay, thank you. Yeah.
Okay, we'll go back to Joanna. Joanna, if you'd like another question, you can go ahead.
Hi, thanks so much for the extra question today. My question's for Dr. Richardson. Dr. Richardson, do you have an estimate of how many cases are being diagnosed? You know, for example, Dr. Zane Shagla has estimated that it is at most 1 in 7, could be as few as 1 in 10 cases that are currently being diagnosed because of, you know, the changes in rules to testing. Like, do you have an idea or an estimate on how many cases there actually are in Hamilton?
Yeah, thanks, Joanna. I think that's a hard number to get an estimate of. We knew even before this that the proportion of total COVID-19 cases that were being found through testing was probably in that, 1 in 5, 1 in 6, 1 in 7 range beforehand. And now it's certainly much lower than that as we've moved forward and seen that there really aren't a lot of other viruses that are circulating. So that most people who are experiencing this kind of, runny nose, cough, fever, that is almost certainly going to be COVID-19 at this point. So I would say it's higher than those numbers. But to get an estimate in terms of a further multiplier is difficult to do at this point.
Great, thank you. We'll go back to Bobby. Bobby, if you'd like another question, you can go ahead.
I'll never turn down another question. My question is for Dr. Richardson. We've received some kind of questions about long-term care homes. A couple local ones are seeing some pretty big outbreaks. Despite having like solid vaccination rates in terms of first doses, second doses, booster doses, can you just explain what we're seeing there?
Yeah, thanks, Bobby. We've got multiple outbreaks, of course, in long-term care homes, retirement homes, congregate settings. When we're sitting at 75, we're well up there in terms of the number of outbreaks that we have. So, fortunately, most of these continue to be small. They're caught early through the symptom screening on entry to work and the RAT tests that are being done, the periodic testing that's happening with staff and with the surveillance that's going on with the people who are living in those homes. Unfortunately, there are some instances where we do see these larger numbers of cases. Oftentimes that they've come in and managed to spread again through things at times like break rooms, sharing rides in and that sort of thing continue to be some of the things that we occasionally see are happening, but fortunately, in most cases, the outbreaks are small, and generally, so far, severity has not been so bad. So we're all watching this very, very closely as we go forward. But fortunately, just a few of those larger outbreaks so far to date.
Thank you.
Thank you, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today. So I will pass things back to you.
Great, Jasmine. Thank you very much. And thank you to our media partners for the questions. And of course, to Bill Custers and the entire team at Cable 14 and Clear Cable for helping putting these together. 100 plus of these media advisories have been done now in the last year and 2 years, actually, almost. So thank you to all the partners to continue to share this information with our broader community. And of course, for any additional information on financial supports or any of those updates, visit our website at hamilton.ca/coronavirus. And I know that additional financial supports are out there for businesses and individuals. So please dial in and see what you're entitled to help you get through. Whenever possible, of course, shop local, and especially when it comes to our local restaurants, as much as you can. Order in if you can, and if you can pick it up, even better, because the delivery is a significant cost to the to the restaurateurs. So if you can drive by and pick up, that puts more money into their pockets to help support their enterprise. So whatever you can do, shop local and support your local restaurants. And at the end of the day, all the public health measures are important, but the most important one is get your vaccine. Get that booster shot, first dose or second dose, or get to the walk-in clinic for 50 plus at the center to get your booster shot there. And you can walk into any of the vaccine locations to get your first or second dose. I encourage you to do so. It is still the best option to keep us safe. So that's it for today. We will be back here on Monday, January the 24th at 3 p.m. And until then, stay well, stay safe, stay warm, and we'll see you soon.